I am a medical doctor, but I'm not yet practicing in Canada. I am a refugee. I was born in Somalia in 1994. Somalia has been a torn apart by war and famine for a long time. Government institutions collapsed. There is no law and order. People killed every day. In Somalia, there was no future, only survival. My family fled because we had no choice, and we became refugees in Uganda. Uganda gave us safety and the opportunity to live peacefully and with dignity. But growing up in refugee camp was not easy. There was no clear path forward, no idea about where your life was going. Education was my hope. Education was the path I chose for a better future. I worked hard in school and determined to escape poverty. I studied day and night and in top grades. After many years, my dream came true. I became a doctor. The hard work paid off. In 2023, I graduated from King Zizi University of Medicine and Health Science in Uganda. I completed my clinical rotations in Kampala, the capital city of Uganda. I treated patients, assisted surgeries, and worked in different units in the hospital. I saw how poverty and lack of access to healthcare change people's lives. While studying, I also worked to support my family. There was a lot of pressure to succeed and to have different life. Fortunately, the university fees were paid by my uncle. Thank you, Uncle Abdullah. Balancing work and medical school was exhausting, but I had no other option. I believed that hard work, education, and determination would secure my future. When I came to Canada, I was full of hope. I was ready to contribute. I was excited to build a better life. But instead of finding opportunities, the doors were closed. Refugees are not expected to be doctors. Refugees are people who have fallen on hard times. Refugees aren't well educated or able to give back. That is what some people believe, but it is not true. I am a well educated doctor, a contributing member of a community, and I am a refugee. Refugees are not helpless. Many are skilled, talented, well educated, and innovative. I need you to know that I didn't come to Canada to rely on public support. I come to contribute. I come to be a doctor and to help people in need. I remember meeting a mother with an autistic child in Kampala. She had no access on specialized medical care. She had limited resources, no community to rely on. This mother was exhausted and overwhelmed. What could I do to help? I listened to her. I offered emotional support. I made suggestions, but it never felt like enough. I remember feeling helpless because I too was a refugee. My connection to autism was also deeply personal because I have an autistic nephew who I love. I promised myself that one day I would create a safe space for refugee children with autism. Canada is facing a healthcare crisis. Emergency rooms have long wait times. Communities lack doctors, and healthcare work shortages are growing. Did you know over 40% of international trained doctors are unemployed or underemployed? Many international trained doctors work as healthcare aides, personal support workers. They also work as medical officers instead of practicing medicine. Black doctors from African countries face more barriers in getting licenses in Canada compared to other doctors from other regions. Black doctors experience long delays in getting recognized, strict scrutiny to their education, and low acceptance rates in residency programs. Why? Because Canada does not help them practicing medicine when they arrive. It isn't fair, It isn't right, but also it's possible to change. This problem can be solved if we work together. Here's how. We should recognize foreign credential. We should accept foreign work experience. There should be programs to transition refugee doctors. This is all possible to do. Other countries have found solutions. Germany fast tracks foreign credential recognition, allows skilled refugees to enter their field 2 to 3 times faster. Australia allows international trained doctors to work under supervision, reducing integration time. Politicians, business leaders, and community advocates must stand up for a fair system. Without their voices, nothing will change, and Canada will lose out on much needed medical talent, including mine. But I have not lost hope yet. Today, I'm working to fulfill my promise. I am planning to establish a center dedicated providing physiotherapy, specialized medical care, and professional support for refugee children with autism. A place where trained professionals and volunteers can come together to offer hope and compassionate care. Canada needs skilled refugees to help solve its healthcare crisis, to fill labor shortages, to drive innovations. But instead of following our experience, Canada forces us into survival jobs. I ask communities, employers, and policymakers to rethink their approaches. Let us create standards and engage industries and build awareness to unlock this untapped potential. Together, we can build a Canada where everyone has a fair chance to succeed regardless their name, background, or where they got their experience. This is not only about helping refugees, it is about creating a stronger and more inclusive Canada for all of us. Thank you.